अस्सलामु अलैकुम लाहौर। ये मेरी सादत या कहें इकबाल मंदी है कि मैं इकबाल के शहर में हूँ। शुक्रिया उन तमाम लोगों का जो बैठे हैं। मुझे उम्मीद है कि आप लोग जेन्युइन इंटरेस्ट अपने चाइल्ड अब्यूज़ की वजह से हैं। वो जो किसी शायर ने कहा था कि मैं खुद आया नहीं लाया गया हूँ, वो हालत नहीं है आप लोगों की। आई एम हेयर टू टॉक अबाउट डेवलपमेंट ऑफ ए नेशनल hospital-based child protection program in Qatar, and I represent Sidra Child Advocacy here. I'm the medical director. And Qatar, if you know, is a relatively small country, maybe smaller than Lahore, with a population of 3 million only, 10% being natives. So things, I would say, some things may resonate or may be applicable to a big country like Pakistan. But we are here to share ideas because we, and especially countries in South Asia and Middle East, are in a similar stage of transition vis-a-vis our child protection program. I'll talk about the journey, and in between there may be things that could be useful to you, and I'm here to hear other speakers, and from their program we'll take learning points which we can implement in our program as well. So it's a mutual exchange. I do not have any financial disclosure to make. We were hearing on the day one about the depressing statistics about child abuse, especially sexual abuse in Pakistan, where it was mentioned that every 2 years a child is sexually abused. It is not only Pakistan. This violence against children is global and it's present everywhere. And according to a WHO report, up to 1 billion children aged 2 to 17 have experienced either physical, sexual, or emotional violence or neglect. And it causes lifelong impact on health and well-being of children. And United Nations Sustainable Development Goal 16.2 of 2030 Agenda aims to end abuse, exploitation, trafficking, and all forms of violence against children and torture of children. So, what about Arab world? There was when I was before going to UK, I was in Saudi Arabia for a few years in 2000, early 2000, and that time it was not even considered a differential diagnosis when we see a baby coming unconscious and things. So shaken baby will not be in our 5th or 6th diagnosis. There was a concept that this is not our problem, this is a Western problem, it doesn't happen here. No. Some brave researchers and things from Middle East, like we have Muna Al-Khawari from Kuwait here, and Fadil Al-Mahrous from Bahrain, Dr. Majid Isa and Muna from Saudi Arabia, and Muna Al-Sadoun from Oman, Professor Khalid Ansari, all they started, no, this is a problem in our part. And this was there from the beginning. If you remember, it was documented in Holy Quran, Surah Takwir, that about the female infanticide was present in pre-Islamic Arabia. Why it was killed. So it was there, but there was a culture of hushing it up. It is not there. And because of the efforts of researchers, literature started appearing from GCC countries. Qatar being signatory to UN Convention on Child Rights, and its provisions have been incorporated in the Qatar's family law, and it envisions in the Qatar's Visions 2030 as well. Qatar, most of you know because of all this, the beautiful stadiums for the World Cup, FIFA World Cup, and it's something looks like this now, but it was never like this. As they say, Rome was never built in a day. Qatar was looking in late 80s like this, and it improved, the skyline was developed, and is much beautiful and more advanced now. So initially there was pearling and fishing as a profession of people. Then oil and gas discovery, wealth and immigration happened. And similarly, there's problems, immigrant communities and things, and local mixing, and then more maltreatment and recognition also happened with that. So the program, I would say, every country has its own journey, and Qatar has its own. 15 years back, we were talking about capacity building. That was the situation. There was no knowledge. People were not making decisions. There was lack of procedures, processes, what to do. We are suspecting we maybe hush it up. Who will do? We don't know what to do. Who will confront the parents that is abused or not? And lack of awareness of alignment with our stakeholders. People who are working in silos. Okay, even if the people like social worker are designed to deal with this, they will be working but not talking to health sector. Health sector will not be talking to social worker. And it's kind of a one-upmanship thing that, okay, who takes the credit kind of culture. We can describe, and it's not a hard and fast break, I'm just to describe how our program developed. If we can develop in describe it in 4 phases from 2008 to 12, 13 to 16, and 17 to 19, and 2020 onwards. And there are obviously things that we do go across all phases. So phase 1, basic priority was to capacity build. There are 40,000 employees, secondary and tertiary healthcare. We identified groups with knowledge and skills and trained them about child protection and how to spot child abuse case. It comes through ED and all. And then limited decision makings to few people. Okay? And then involved 2 stakeholders, Ministry of Interior and country social services into this thing. When we suspect child abuse, and this was a flow from Hamad General Hospital, and that any child presenting with suspected child abuse would be referred either from A&E or pediatric emergency centers or primary health care. They will come to nearest pediatric emergency centers where they will be triaged as priority 3, or where they will go and see a senior person. They will be kept in an isolation room. And if it's still suspected after that, then consultant will be involved and admit to in the hospital, Hamad General Hospital. And from there, the Aman Center, which is social services, and the Ministry of Interior will be involved, the police will be involved if it's a significant child abuse considered. At that time, because people were not aware, people were not picking up, we made it accountable that if you see a suspected child abuse, you must report. And if you see the statistics from 2012, just to give a sort of a picture of what was happening, roughly 1 or 2 cases every month after all this education, but every case that was suspected was reported, and whatever we targeted, that target was being achieved 100%, but number of pickup of cases was less. And it went on, despite doing all the education and things. If you look, it was 1 to 2 and went up to 15, roughly 20, around 20 it was plateauing. By 2016 and not rising despite all the efforts we were doing, we were not picking the cases. We knew that there were more cases that we were not picking. Gone this slide. Sorry, I'm going back. So in phase 2, we felt that cases are being plateaued and more complex cases are coming. We need involvement of more stakeholders. We did a scoping exercise with other GCC countries where we assessed readiness assessment of implementation of a larger scale child maltreatment prevention program, and we feel that out of 100 different scores, we were 37.8, which is quite low in many areas, and it highlighted the need of capacity building among organizations across Qatar for a larger scale CMP program to be successfully implemented. So we went on to organize, involve more stakeholders, and it was not easy. Bringing them in the same room, talking to them and bringing them in the same table and work together, it took hard work, multiple sittings, people were coming, and to convince what is in it for me or my organization, that sort of a thing we started. Then we try to convince them that this is child and that should be kept in the center, and we all work. And then we convince that, look, being health, we do not have all the answers. So being a social work organization, you can bring this expertise. Being a Ministry of Interior, you can bring this expertise if child abuse happens. And then together we can provide some justice, some good care to this family or the victims or vulnerable families. And then they started thinking that, okay, so if we work together, and what we did is the success stories from phase 1. So we presented those cases there in the meetings and said, look, we did this, that's how our outcome was. But maybe if you were involved, you could have brought this and we could have done better. So that way they were convinced that, okay, we can come together and work together. These were the stakeholders, were different healthcare setup from primary, human rights, mental health, different social services and ministries, education, all were involved. Objective was to understand the scope of our service and countrywide assessment of identify available resources and examine the current workflows and how we can resolve the obstacles, work collaboratively to align available resources and services, and develop forum of stakeholders to exchange ideas and work on improving services and resolve the gaps. And then we decided to agree on a national child protection workflow and to avoid duplication and create a lean process so that we are not duplicating and ensure accountability. So this is a busy slide. This is how our national child protection flow looks like. So there is one central hub we created, which is based in a hospital, largest tertiary children's hospital, which is Sidra Medicine. All referrals about child abuse concerns will be referred to this entity, okay? And there will be 24/7 calls, and then we will decide whether it's acceptable or not, maybe sometimes, and then so how urgent it is, and then if it is urgent, then we'll be seen same day, either in the clinic or in the emergency medicine, or next available slots if it's not urgent. And then there is different pathway for sexual abuse, neglect, physical abuse, and things, and how they will be followed up. So it's a big slide, but it's a very important work that we did. And this is how the initial flow looks. So from either primary healthcare center, schools, hospitals, everywhere, they will be referred to Sidra Child Advocacy. Then we decide, and then accordingly. And this is just showing the others. And then we founded a National Child Protection from Abuse workshop. Every year that will happen. We identified gaps. We thought that there is people are not keen to talk to children. So how to talk to children is an art in child abuse cases, especially where they're 5 or 6 year old, or if older children, that's so how you ask them questions, do not ask leading questions and all that we wanted to train. So we invited a forensic interviewing expert from US and organized a 3-day workshop where 50 delegates from different organizations attended and found very useful. And then we found also a National Child Protection from Abuse group at Ministry of Public Health, which will meet every year and oversee the implementation of this program. The whole pathway will be overseen, what are the obstacles, and we will feed to them, and they will find answers. So phase 3 was with the, so after the development of, we agreed on a flow, the central hub was created at Sidra Child Advocacy Program, recruited a specialist team for child abuse, and then a manager, which is Qatari, so that she could liaise with the outside agencies, speaks Arabic, and we provided on-call 24/7 hotline, reached out to all medical and non-medical stakeholders in the country, and went on to awareness drive. So this is the National Group of Protection of Children from Violence at MOPH. This committee oversees the implementation of the program. We have signed Ministry of Interior between Aman Center Protection, and this was the social service agency of the country, with the Doha Institute of Family Medicine, with social policing, and so that we work closely and we know exactly what we are doing in each other, with prosecution, family court, WIFAQ, and all that. We've also worked closely with embassy. We had worked with Australia and New Zealand, because Qatar is a big expat population. Only, as I mentioned, that's only 10% are local Qatari population. Rest 90% are expat population. This is one picture where we are liaising with embassy. We went on public hotline and child safety. So there is one hotline which will be directly called to the doctor or professional on call from all the professional areas, like any health center, any PHCC, any primary pediatric emergency center. And the other one is for members of public to call if they are concerned about child abuse. And we advertise this one. We get about 4 to 5 calls a day and 1 to 2 international calls as well per month, because it's well advertised.
يحتاج الأطفال للشعور بالأمان
والتقدير
والاحترام، وهم على ثقة تامة بأننا قادرون على حمايتهم من الأذى.
نعمل بفريق واحد
للقضاء على هذه الظاهرة.
فنحن لا نتوقع التعرض للظلم وسوء المعاملة.
نعمل هنا باحترافية فائقة.
نبذل قصارى جهدنا
سويا نحو هدف واضح. وهو أن نقضي على سوء معاملة الأطفال.
أنا محامي.
أنا رجل أمن.
طبيبة شرعية.
لاعبين في منتخب قطر الوطني.
أعمل في مجال الخدمات الاجتماعية.
تربوي.
أنا أعمل في سدرة الطب.
أنا أدافع عن حقوق الإنسان.
نحن نكرس وقتنا ومهاراتنا
لإحداث تغيير في حياة الأطفال.
24 ساعة يوميا 7 أيام في الأسبوع.
So that was the video.
Sorry.
There's another
Sorry, I'm so careless. I try not to mess things up, but I'm too stupid. Sorry for everything that I've done. I will try to be quiet and not make you mad. I will try my hardest not to disappoint you. I promise I'll do my best to make you happy, not to make you hit me. Please don't think of me as a bad person.
So this was our public helpline. It was advertised in all major news channels about this thing. We also launched a national registry for child abuse. All cases referred will be, and type of abuse will be, all data will be collected here. And phase 4 was mainly few things we did. One mandatory e-learning module we said. Having worked in Manchester and Western, we saw there's a level 3 and level 4 safeguarding, level 2 and level 3 for all people who are working with children. They have to pass every 2 years a safeguarding competency module. Okay, so we came with an e-learning module, and everybody in Sidra Medicine, and now is being mandatory to other people who are working with children to complete this. And there's 20 questions you have to answer, and you get a pass mark. So this is kind of a basic level of benchmarking that our people who are working with children have certain knowledge of these things. And this is something which we were talking about parenting learning module earlier. So we could do in a big country like Pakistan something like that, that make it mandatory to every pediatric graduate or every so a pediatric trainee has to complete this sort of safeguarding module or something, so that at least they have, or even at MBBS final level, that they know how to spot a child being abused. We did an audit of this one. We were aiming at least 90% uptake, and we were quite close. We also came with a medical health record notification. Obviously, Qatar is quite into digital health, and everything is, medical records are all computerized. So we put, if there is a child comes, and you know, it's difficult to separate children from families. It's not like Western model where if there is any abuse happen, you go and separate the family. We want to work with family, and there are many advantages of that by educating them, by telling them that this is not the way. But if they have significant concern, we will put an alert system on their medical records. So it will come a pop-up, call escape. If children who have been, we know that abused, but we have been not able to remove that child, we want to work with the family, we'll put this. So if next time they go to any healthcare sector, this will pop up and they will straight away come. This is kind of a safety netting for children, because it's well known in West, in UK, parents who, one hospital has flagged as a child being abused and they are on suspicion. Next time the child breaks or there's a burn they cause, they will not go to the same hospital, because every ED and everybody know that this child, and records know. So they will go to a different hospital, window shopping, and that's how it misses. The system misses that. So to mitigate that, we put this alert and to safety net. We also lucky to host with Dr. Tufail being here when he was president of SPECAN. We held this SPECAN 2020 Congress, and this was a huge lift for a small country in Qatar to hold this big conference, and everywhere it was talk of the town and awareness drive. This is from yesterday, children were performing. There also our children were participating. This is from the inaugural function. And we did one more thing. We asked children of all schools in Qatar to participate in an art competition, what child abuse means to them. Okay? And this is a collage of different drawings we got from there. And it was displayed, if you remember, in the hall where the posters were there and children's drawing. And I think children's drawing were attracting more people there because it was so graphic and things they draw. So this helped us raise awareness among school children about child abuse, and then we took an opportunity to tell people about our what our referral lines and which number to call. We have gone to schools, or school sometimes come to us, what is this, how we do. Newspapers, television. Here our founder, Professor Khalid Ansari, who should be here but couldn't come because of some national duty, came. He is in the TV telling about corona, what are the risks. We are launching internet media safety page soon with these partner organizations, where there will be available information about cyberbullying and where to seek help, or any inappropriate material, sexting and all that. We held a symposium on internet safety. These are the Arabic version of that. We also launched a sexual health workshop for kids above 10 years. It's a 3 hours workshop conducted. We have conducted 3 sessions, and it's a taboo in our societies to talk adolescent children about, but they are getting information from internet anyway. So why not give this information to them in a more sort of filtered way, where they know exactly what are the harms, and there are people from religious affairs as well, if you see, culture and youth, and Ministry of Awqaf and Islamic Affairs as well. So it's a big problem of gender identity coming in our societies as well because of the internet and things. Children were, I'm not what I am, and so that they're given information, and if they're involved in any risky behavior, where they can get help anonymously. So this has been launched through us. We have been to outreach events, any opportunity we take, like education, welfare, wellness fair, domestic violence awareness. We go put up our stall, tell people about what we do. This is a national event, Darbal Sai, where children came to our stall in big numbers. This is me highlighting risk of COVID-19, how it puts, and it was all major Arabic and English newspapers, how children are more prone during this. There's a WISH conference. We had an annual day with a UNICEF and all, and to make people aware about child abuse. We came with some publications, and one of them was addressing violence against children through a systems strengthening approach. Sidra Child Advocacy was part, so it's kind of a document where everything is documented, what we are doing. And time to time we come up with the national press. We go, like school holidays could be a time where it's a good time where families come and joint families, but then there's a risk of abuse as well. So sexual abuse, people forget children. There have been incidents where parents, because there are many children in there, they forgot children in a car locked, and few hours they're gone, and children have come heat stroke and things. And drowning is very common because swimming pools are there, and people sometimes. So we have been to a media drive to warn parents about that. And this is a slide I'm very proud of, that if you look at what we started from, like cases were like 2022 per year, despite giving education, since this model of a single hub at a leading hospital, healthcare-led system has been launched, we got almost 10 times number of referrals increase. It went up to 328, came down slightly during the COVID, but it started getting up as well. Our bulk of patients are physical abuse, then not almost 25%, 1/4 are sexual abuse as well, and then neglect and other cases. So in summary, I would say this is our modest achievement I wanted to present. And I would say through public awareness and stakeholders in education and engagement, our hospital-based National Child Abuse Service has been able to see 10 times increase in the number of referrals. Obviously, there were challenges of involving stakeholders, asking them to change the way they do their practice. But it has been a rewarding journey. Thank you.